everybody. A very good afternoon to all of you. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be doing really good. So today we are here to discuss a very important topic, and the topic is how to manage acne. Now, acne is something, most of us has gone through that phase of acne vulgaries, whether as a teenager or young adolescent. We all know how difficult it is, and though it hampers our appearance, it affects our appearance, but deep down it affects our confidence level as well. Many times people go into depression just because about acne, and discuss how to manage acne. And today we are going to do exactly that. We have with us Dr. Reshma N.P, who's going to join very soon. She is the skin expert of today's. And so before she joins us, let me introduce her to you all. She's a very renowned skin expert from Bengaluru. So Dr. Reshma N.P is an accomplished dermatologist and venerologist with extensive academic and clinical experience. She earned her MBBS from Kempegowda Institute of Medical Sciences, Bengaluru in 2016 and completed her diploma in dermatology, venerology and leprosy DDVL from Kurnool Medical College in 2020. With exceptional performance. Dr. Reshma has presented e-posters and papers at prestigious conferences like APCuticon and PDermicon, focusing on rare syndromes and pediatric dermatology. Her research contributions include published articles in IOSR, Journal of Dental and Medical Sciences, covering topics such as dermatological patterns and topical corticosteroid abuse, and currently she serves as the founder and consultant dermatologist at SkinCareForAcne Clinics, Bengaluru. It's such a pleasure to have you with us, Dr. Reshma N.P. A very warm welcome.
Thank you so much.
So, doctor, today we are going to talk about acne management, and acne is such a chronic skin condition. It is so common. 85% of, people who attain puberty, who are in their teens or adolescents, do face these acne. So it becomes even more important to talk about it. Then we have acne for, those who have oily skin or acne prone skin. Adults also have it many a time. So we'll try to discuss it all. But to start with, what is acne, why it happens, and what are the various types and grades of acne, Dr. Reshma?
Right. Acne is commonly, as we know, in common terms, it is known as pimples by the common people. But in medical knowledge, acne is actually a disorder of the pilosebaceous unit. When we mean pilosebaceous unit, it includes the sebaceous glands, which are the glands which produce oil secretion into the skin, as well as the hair follicle, which is attached to the sebaceous gland. So whenever there is excess of secretion of oil from the sebaceous gland, either because of hormones or other dietary factors, as well as local factors, this excess of sebum or the oil will actually block the hair follicle, which is opening onto the skin. This blocking of the hair follicle will in turn produce comedones, which is the first type of acne lesions, which is noted. This is stage 1 of acne. And when this comedones get infected by the locally residing bacteria, that will produce other stages of acne, which are red and inflamed type of acne. So then coming to the different types of lesions which you see in acne, the first one is what we know as comedones, that is produced by the blockage of the hair follicle and the duct by the excess of oil which is produced. And when this comedone is getting infected from the locally residing bacteria, we go to the second stage known as the papules, that is the red ones which is commonly seen. Once these red ones become more and more inflamed, then you can see a pus point which is emerging out of those papules. Then we go to the third stage of acne known as pustules. And when these multiple pustules join together, they form a very big structure on the or a boil on the skin. And then they can also join together form what is known as a cyst. So we have comedones in grade 1, then grade 2 we have papules, and grade 3 we have pustules, and at grade 4 we have what is known as nodules and cysts.
Right, so it's very important that as soon as we see or spot these acne, we should go and consult a qualified dermatologist. But then, Dr.
Correct.
Reshma, I'm sure you will also agree with me that in our society, we are so obsessed with home remedies. Then,
True.
we have these over-the-counter topical applications because it's easily accessible. So we'll go to a nearby chemist shop and, ask how to deal
Yes,
with it.
apply.
They'll give us a tube and we'll keep on using it. Now, my question to you is, Dr. Reshma, if you can just explain us and make us understand why these home remedies or, using these topical applications from a nearby chemist shop without a prescription can be harmful.
The first thing when we come to home remedies, the type of remedy actually varies from type of the skin as well as the grading of the acne, and as also depends on the age of the person and also the cause which is triggering the acne in that particular person. But home remedies cannot be tailored according to these needs. So I have many patients who come to me that they have been applying turmeric, neem, and chandan, and when anything, any blood product as well as gram flow which is available at home. All these things, the first thing is they can cause an allergic reaction on the skin, thereby exacerbating the pimples and the acne. They can also dry up the skin, thereby destroying the skin barrier. Once the skin barrier is destroyed, it is easier for the bacteria to enter deeper into the skin, again causing more pimples to get secondarily infected and produce more pustules and nodules. So that's the problem with home remedies, that they can dry up the skin, damage the skin barrier, and cause allergic reaction. When it comes to buying the over the counter over the pharmacist, the thing is the pharmacist obviously doesn't know the treatment of acne and how to treat it, and most of the pharmacists usually dispenses steroid containing creams, and that has become so rampant in our society as of now that many people are using steroids just like they use Fair and Lovely or Vico turmeric as a cosmetological thing. And steroid is a very bad thing to be applied on the face, especially if it is not tailored according to the skin, and the concentration and the strength of steroid is not tailored to the need of the patient. So many patients, most commonly the creams which they use are Pandem Plus, Tenovate, Betnovate. They're not supposed to be applied on the face at all. They're too high concentration for the face. Initially, they will give some result because they reduce the inflammation which is present on the skin. Thereby, the patient feels that their acne or any other skin condition is getting better. But as they continue applying the cream in the long term, the skin barrier also gets destroyed. There will be skin thickening. They'll develop wrinkles, and ultimately, once they stop the cream because of these conditions, the acne will flare up. Like whatever acne they had in the beginning becomes 10 times more. And when that happens, treating that acne will become a very big headache for us dermatologists also. When they come to us with, applying steroids for 1 year, 2 years continuously, and then they come to us with, big nodules and cysts, and then they expect us to treat it overnight, or they tell we have a wedding coming up, we have an engagement coming up, and they want us to treat it and make their skin get back to a normal within 1 or 2 weeks. That is not at all possible when the skin damage is happening for 1 or 2 years or so. The third thing is, most of the time, whatever people consider it as acne may not be acne at all. There are many lesions which look like pimples or acne, but they're not acne. For example, we have a viral infection called molluscum contagiosum, which is transmitted through sexually as well as through touching. So many people have those molluscum contagiosum on their faces, and they think it is a pimple, and they start applying all anti-acne medications as well as the pharmacy or taken steroid creams and all. That is actually going to worsen those infections, and they will not get any result at all. So these are the 3 points, that home remedies may actually damage your skin, and it is not tailored for the type of acne, and OTC products may not be suitable for the acne at all. It might be some steroid containing cream, and it might be wrong diagnosis also. They might be having something else other than acne, which is going to worsen the skin and not help in their treatment of acne in any way.
So what I can make out of what Dr. Reshma has just explained is that, a very normal tendency is that we are going to save our energy, our time, our money, and our issue just by going to these, for home remedies, quick fixes, DIYs, or these over-the-counter applications. This is what a normal people, a layman feels. But they end up spending more of their energy, more of their time, more of their money, because ultimately they'll have to go to the doctor, but then Beforehand, it was just acne. Now it's something else as well to treat. So don't extend the the treatment length just by going for other things. Go to the right person at the right time. So as soon as you spot these acne, pimples, whiteheads, blackheads, whatever, go to a qualified dermatologist. Now, doctor, as I just mentioned, there are so many influencers also on various social media platforms these days, and many of them they have quick fixes or DIYs for skin as well, or skin related issues that as well, and most of them are not qualified dermatologists. Now, my question to you is, they are also endorsing products. Market is flooded with products. Is going for all these products, buying like 10 bottles of, skincare products and applying, and also changing, experimenting a lot, they can also lead to acne formation?
Yes, definitely. The more irritating your skin is going to get because of the application of so many products which are available on Instagram pages as well as Facebook pages, the more the skin gets irritated, the more it's going to get damaged. And once the skin gets damaged, the acne is definitely going to exacerbate, and whatever acne they had before will also become more. And if they didn't even have acne, they are going to start forming in future also. So I have seen many people, buying bottles and bottles of salicylic acid creams and serums, where even the percentage and the concentration of salicylic acid is not at all mentioned. There is a particular concentration which can be applied on the face. We cannot use unregulated concentrations on the face. So, but there are so many over-the-counter products where the concentration itself is not at all mentioned. So I would suggest that never to use those products which are available online, which is not recommended by a dermatologist. They will definitely tell you it is certified by a dermatologist or recommended by a dermatologist, but that is not true at all. A dermatologist will never recommend one particular product to a mass population. It will always be tailor made to a particular patient.
We all are different, just like the way our fingerprints are different, our skin is also different. Our skin conditions are also different. And thus, as Dr. Reshma has very well said, that we need a tailor-made, customized therapy, and for that we need to go and consult with them. Now, coming back to our topic, acne management, doctor, we always hear that a good skincare routine is essential to keep your skin healthy and also keep acne, etc. at bay. But then, as we were just, talking, that people are ending up buying like 50 bottles of products in the name of skincare routine. And of course, nobody is going to be consistent with those 50 bottles. Now, my question to you is, doctor, how to keep a basic skincare routine? What are the essentials to go for, with which we can be more consistent in our approach of skincare?
Right. The basic three things what we need for a daily skin care is a sunscreen, a mild cleanser to wash your face, and a moisturizer. And only in some patients who are crossing around 40 years of age, we recommend an anti-aging cream to be applied at night. So when we talk about cleansers, it has to be mild, which should not contain any sulfates and paraben free. And if they are going for salicylic acid based cleansers, the percentage should not exceed more than 2%. Anything more than 2% will actually dry up the skin and crack the skin up and producing peeling of the skin, which is not necessary. Then when coming to the sunscreen, this is the most important thing in the skin regimen. Most people don't do that. They will be thinking that they're just spending 15 minutes in the sun just by traveling in the bike or going in the car. I'll be inside the car or I'll be inside the bus or something like that. But still they are exposed to the sunlight for at least 15 to 20 minutes per day. And with this slowly cumulative exposure of sunlight and exposure to UV light will actually damage the skin. So sunscreen is a must and should. And if the skin is acne prone skin, the sunscreen you choose should always be a lightweight one, which is gel based. It should not produce a thick coating on the skin. Like thick coating will actually cover up the pores on the skin, thereby producing more acne. The oil which is produced will not be able to come out of the pore, thereby producing blockage as well as acne in turn. So when they choose sunscreen, it has to be lightweight, which is gel based, should not produce a white casting or a thick layer on the skin, and preferably with an SPF of more than 50. And the third thing is the moisturizer. If they feel that the skin is too much drying up even during summers or winter, use a very light based moisturizer which we usually call as humectants. There are three categories of moisturizers which dermatologists actually prefer, but in acne prone skin we prefer something known as humectants. Humectants usually contain hyaluronic acid, aloe vera, glycerine and alpha hydroxy acids. These are lightweight moisturizers which do not produce that greasy look or the greasy feel on the skin. They just mix with the skin and give a matte finish like kind of finish. So when you can apply the moisturizer as a base on the skin, and over that you can apply the sunscreen in the morning, and in the night you can apply moisturizer as such. If your age is above 40 years, then we recommend an anti-aging cream which sometimes contains retinol or bakuchiol as an alternative. So these are the three major things anybody will require. Nothing more than that is required apart from this. And above 40 years old, we recommend an anti-aging cream in addition to these three stuff.
Right, so cleanser, moisturizer, sunscreen, and in case you are 40 plus, then a night cream. Now with the cleanser, doctor, because many times what happens, especially with those who have oily skin or acne prone skin, they feel that it is just because they are producing more sebum or oil, they are having acne, or just because they have a dirty face, they are having acne. So they keep on washing their face again and again. Now, what is the right way to cleanse of your skin? How many times is okay?
Twice a day is usually recommended, like once they leave the house and when they're taking bath in the morning, and once in the evening. Twice a day is recommended, but that has to be a very simple wash, and not scrubbing is not recommended. Many people have the habit of scrubbing their faces for too long a time and using too much of friction. The scrubbing is recommended only twice a week. If they keep on scrubbing their face every day or even twice a day, that is going to again damage the skin. So the usual cleaning the instruction should be that they have to wash their face with water and the cleanser twice a day, preferably lukewarm water and cold water. Hot water is not indicated on the face. And if you want to scrub the face, it has to be done only twice a week.
Okay. With sunscreens also, as you said that, what kind of sunscreen we should go for in case we have a oily or acne prone skin. Now, but then people also are confused about when to apply sunscreen, when to reapply, why reapplying is important, and how much sunscreen to apply, the amount of sunscreen. If you can just shed some more light over that.
Sunscreens are usually instructed to apply 30 minutes before sun exposure. Say if they're leaving their houses at around 8 o'clock or 9 o'clock, they're supposed to apply the sunscreen to the face as well as the neck portion half an hour before that. And most of the sunscreens usually have an action of 2 to 3 hours only. So sunscreens has to be reapplied every 2 to 3 hours if there is continued sun exposure. But now we have sunscreens which come with the instructions that it lasts for 12 hours, it lasts for 24 hours. If they are using that kind of a sunscreen, which are pretty expensive actually, so that can be applied once a day or twice a day depending on the sun exposure. But in between, if the patient is having a lot of sweating, or if they go in a swimming pool and have a swim and they wash their face later on, then they have to reapply the sunscreen. So if they are using a normal over-the-counter product like Acne or any sunscreen from the over-the-counter, it has to be reapplied every 2 hours. And the quantity of sunscreen, it again depends on whether the sunscreen is matte finish or whether it gives a greasy look. Normally what we tell is from the tip of your finger till the line of the first line of your index finger, this much, like one line of sunscreen if you take, this is going to cover your entire face. And again another line will cover your entire neck. This is what we call as 2 fingertip units. Like from the tip as till the line is 1 fingertip unit. So if you take 2 lines of the sunscreen, that is going to cover the entire face as well as the neck. But if your sunscreen is too oily, I would recommend to go for a half fingertip unit. Like just from here till the half of the finger. That is enough to cover the entire face, and another half will cover the entire neck.
Fair enough. And doctor, as you also said that moisturizer is equally important, but again, then those who have acne prone or oily skin, they normally skip the moisturizer because they feel that they are already producing so much of sebum. Why to put more moisturizer on their skin. Yeah. So, why moisturizing is important even for those who have oily skin?
When the skin is not moisturized, it tends to crack and produce very dry skin. And those cracks are a very good way of bacteria to enter in between the skin. When bacteria enters, again, it produces secondary infections. So along with acne, we also see infection of the hair follicle known as folliculitis. So what moisturizer does is it covers the cracks which is present in the cells of the skin. It just forms a protective layer over the skin, covers up the cracks or the breaks which is present in the skin. So that will actually form a protective layer. And on top of that, if they apply any sunscreen or any product, the allergic reaction to those products is also minimized when moisturizer is used.
Hmm. Doctor, when a patient comes to you with acne, are there any tests that you normally recommend for diagnosis, or just by clinical investigation, you're sure that this is the acne, this might be the cause, and this is the grade, etc.?
It depends on the age as well as the severity of acne. We normally expect acne to appear from the age of 13 years and continue to appear till the age of 25 years. This is the normal period for acne to occur. And during those periods, and if the severity of acne is from mild to moderate, we usually don't prescribe any tests for those patients. But if acne is appearing after 25 years of age, and if the severity is more than we expect for that particular age, then we go for hormonal assays, because if there is any hormonal imbalances, those are the most common causes for acne to occur in patients who are about 25 years, as well as the severity of acne to be more. So that is the first thing, we get it done. We get hormonal assays done in such kind of patients.
And what are the treatment options available, doctor?
Again, it depends on the grade of acne and the lesions which are present. Like for comedones, and for the first grade of acne which comedones are present, we go for creams which contain anti-comedolytic properties. Those are the creams which can actually destroy the comedones. They usually contain adapalene or azelaic acid. Then when we come to the grade 2, that is papules, we usually go for topical antibiotics, meaning antibiotic in the form of creams to be applied in the night. And we sometimes combine with adapalene as well as azelaic acid also. But when it comes to pustules, that is the third grade of acne, then we go for oral antibiotics along with the topical creams and cleansers. Then finally, when we come to nodulocystic type of acne, where we have big cysts and nodules present on the skin, then the drug of choice is what is known as isotretinoin. That is the basic thing. But problem with isotretinoin is it cannot be prescribed to girls or women who are in the reproductive age group, because it is going to damage the fetus or the baby if they conceive. And the drug is going to stay in the blood for a longer period of time. So we avoid that in people who are in the reproductive age group or they are about to plan their pregnancy. But in men and younger girls or older women who are having nodulocystic acne, we usually go for tablets which contain isotretinoin along with antibiotic cream.
Right. And after, treating acne is one thing, and treating acne scars or, post-acne pigment-free marks, etc., they look like the bigger challenge. And I'm sure those who had acne, they know how difficult it is to deal with those scars and marks. So, A, what to do to prevent those scarring, marking of, post-acne? B, in case we have them, what are the procedures or treatment options available?
First thing, whenever anybody is having a pimple or an acne, they should not touch the acne, should not try to pop it or try to remove the pus which is present inside. Whenever we press a pimple, the thing is only 20 to 30% comes out from the skin, whereas the remaining 80% actually goes inside the skin. So that pressure which is applied retrograde will actually produce acne scarring as well as pigmentation. So please don't touch your skin or try to pop your pimples or try to remove the pustules. Let the pimples reduce on its own, or please visit a dermatologist to get an appropriate treatment for a faster resolution. That is the one thing to avoid scarring. But some people, they have a scar-prone skin. Like even if they don't touch the acne, even if they don't meddle with the lesions, they're still going to produce some of the scarring in such people because the skin nature is that way. In those people, we can go for treatment. But the problem with scarring in acne is that none of the creams or serums actually work, and then we have to go for procedures or what we know as surgical management. As of now, for acne scarring, we go for 3 levels of treatment. One is known as chemical peeling. The second one is known as microneedling radiofrequency, and third one we go for ablative lasers. Most common is the fractional carbon dioxide laser, which we use to treat acne scars. So these are the 3 options we have for acne scar management.
Right. Doctor, many times we see various patterns of acne. We see small bumps on our forehead, or alongside the jawline, we see the acne. Many a times it's in the butterfly area covering the cheek, nose. So do they tell us something? Do they symbolize us something?
Yes. Like whatever acne we have on the butterfly, that is we call as the T-zone, like over the nose and over the cheeks. These are the common places for acne which is seen in teenagers because the sebaceous glands are located much more in quantity in those areas. So when we see acne basically in the butterfly regions, we just consider it as a normal pimple which might occur in the teenagers. But when we see that the acne lesions are most commonly concentrated or they are distributed only in the forehead region, we suspect something known as pomade acne. Pomade acne is wherein the person is applying some hair product onto the hair, and their hair is coming in contact with the forehead, as well as the product is also like running over the forehead. Those products can irritate the skin over the forehead, so producing acne majorly on the region in the forehead. So most commonly people who apply too much oil on their faces, there's hair styling gels, hair sprays, as well as if they are suffering from dandruff, their acne will be concentrated in the forehead. So we concentrate on those conditions and treat accordingly. And when we see acne, this is the common when we suspect hormonal imbalances, especially in adult women. When the age of the patient is above 25 years and we see acne eruptions in the jawline, in the mandibular region, that is when we suspect the hormonal imbalances might be taken place in the patient, and then we recommend to get some hormonal assays done so that we can treat the patient on hormonal therapy for acne. And the third thing is, if we find acne in unusual places like in the lower portion of the neck, then we suspect that the patient might be applying some steroid creams, and the steroid creams has led to secondary production of pimples or acne.
Okay, right. So these pimples and their location also tells a lot of things. Now, doctor, many times people who are prone to have acne, they often ask, "Can I use makeup?" Many times makeup is just something to enhance their appearance, which they like, but then again it can be a necessity, a professional necessity as well. So in case they are prone to having acne, can they apply makeup? And if they have to, then what are the precautions they should follow?
People who have acne prone skin, I would suggest that they first apply a layer of moisturizer before applying any kind of product over to their skin. The moisturizer will form a skin barrier so that the products which they use in makeup will not produce any infections. Secondly, the makeup which they use should not be greasy. They have to go for lightweight, non-comedogenic makeup products so that it doesn't block the pores, thereby producing secondary acne. And the amount of makeup they apply has to be minimum, and they have to wash their makeup off as soon as the work or their job is done. Makeup should not be left on their face for a longer period of time.
Okay. Any lifestyle modification or anything to include or exclude from our diet in case we are prone to acne?
Yes, there are many dietary questions we experience, like patients ask us what can be eaten and what cannot be eaten. It is proven through various years of research that diet which is rich in calories like chocolates, pastries, oily foods and sweets actually increase the production of acne. What happens in this is whenever people are eating high calorie diet, there is production of insulin in the body as well as something known as IGF, insulin-like growth factor. This actually is produced by the body to bring down the sugar levels, which is raised by these diets like chocolates, pastries and other oily foods. Once this IGF is produced in the blood, it acts on the sebaceous glands and thereby stimulating more number of cells to be produced as well as sebum production. So again, more sebum production and will cause the blockage, and in turn it will produce acne. So dietary control is that people who have acne prone skin have to avoid consumption of chocolates, sweets, pastries, oily foods, and any kind of food that is very, very rich in calories. And coming to lifestyle modification, obesity is directly related to, again, high calories as well as acne production. So in general, their diet has to be a balanced diet which should contain moderate amount of carbohydrates and fats as well as high amount of proteins and vitamins. Even excess of vitamins can also trigger acne production. I have seen many people who take vitamin B12, vitamin B complex tablets regularly, and vitamin B complex is known to produce acne. So excess of anything is bad for the human body as well as for the skin. So the diet has to be balanced in all aspects, and they should have a healthy lifestyle with regular exercises, walking, and everything that is going to keep their obesity under control, and in turn their hormonal levels also under control.
We are getting so many questions from our viewers. I'll like to take them one by one. So one question is here, which is associated with stress. Kiran is asking, how does stress impact my acne and how can I manage it?
Sorry, I couldn't hear you.
Kiran's question is, how does stress impact my acne and how can I manage it? Stress.
Yes, just like I told you, diet as well as lifestyle which is going to affect the acne, stress also has the same impact. When you're having stress that is going to result in lack of sleep or your diet is altered, there are stress hormones which are produced by the body to fight the stress in the body. So those hormones will actually produce a lot of changes in your skin, and that is going to produce acne. So if you're having a stressful life, I suggest that you go for have a brisk walk in the morning, go for meditations and yogas and any other therapies which is going to calm your mind and reduce your stress. And reduction in stress will help reduction in your acne.
Okay. Sia is here and her question is, are there any ingredients I should avoid in skincare products?
As such, the skincare products will contain around 100 ingredients. If you look into the back of the bottle or the pack, you can find some 100 products. And generally, we cannot tell you that you have to avoid all these products for a particular patient. Some patient might like the product, some patient might be allergic to that. So again, that advice can be given only to that particular patient based on the skin type and the type of thing. But in general, I would like to say that salicylic acid and other acid containing products which are more than 2% are usually detrimental to the skin, and those have to be avoided. And if you are using retinol based products, they have to be avoided during pregnancy or if you're about to plan for pregnancies. So most people continue using those products without knowing that they're actually damaging the baby in their uterus. So if you are planning for a pregnancy, be careful in what products you're using and what ingredients it contains. Apart from that, it is very difficult to tell in a general term which products to avoid.
Right. We have Jaya with us. Her question is, in fact, I'm getting a lot of questions related with mental health. So the question is, what should I do if I feel that my acne is affecting my self-esteem or mental health?
First thing is, please visit a dermatologist and get the proper treatment and care for your acne. And once your acne comes down, obviously your self-esteem is going to improve and it is going to improve your mental health also. Secondly, remember that beauty is only skin deep. It's not the beauty of your face that matters. It is the inner beauty that matters for most of the time. Your acne years of education is what matters in the long run. So don't concentrate too much of the beauty on the skin. We are there to treat that. So don't feel bad about just because you have an acne on your skin. We are there to treat for that. So you concentrate on your regular lifestyle and don't feel bad about it. Please visit a dermatologist and get a proper treatment for acne.
Right. Many times we see a lot of parlors, salons, quacks. They also claim that they can do the procedures, microneedling, uh, peels, etc. Uh, how safe are they? Or why it is important to go to a qualified dermat to get these procedures done, doctor?
Peels have to be used for a particular amount of time, and particular concentration has to be used to get a very good result. If the concentration is less, we will not get any result at all, and if the concentration is more, it is actually going to burn the skin. What happens when a quack or a beautician is performing chemical peeling or any such kind of procedures like hydrofacials? They are not knowledgeable about the concentration of peels to be used, and for what type of skin it has to be used, and for how much period of time they have to be left on the skin. I had a patient where they had gone to a quack and they had applied a peel which was supposed to be washed off within 3 to 5 minutes. They had left it for 8 hours. Her skin had such a feel that as if some a pot of hot milk had fallen on her face. The skin had totally burnt out after leaving those chemical peels for 8 hours. It took me almost 6 months to treat that burns and get her skin back to the normal. Just for that one day, she could have visited a dermatologist and saved that 6 months of pain as well as all the impact she had on her mental health. So that is the thing. They just have the products with them and they know how to apply it, but they don't know when to apply it, for how long to apply, and what concentration to be used. That's the difference between a qualified dermatologist and another person who is using those products.
The fact remains, in case we have some eye related issue, or we can see that we are something is affecting our vision, we go to a eye specialist. In case we have chest pain, or we'll go to the right person, to a cardiologist. We won't go over the counter, or we won't go to any quackery and say that treat me. But then with skin, I think we are a little more lenient. We don't take that much interest, or we try a lot of things on our skin. Being the largest organ, skin also requires some amount of respect, some amount of good treatment. Don't abuse it, be it with steroids or with any quackery. Now, doctor, before we sum up the whole session, any take-home message for our viewers?
The first thing again is, please don't go for self-medication in acne. Self-medication itself is going to produce a lot of problems. So please visit a dermatologist whenever you want a treatment for acne. Avoid buying over-the-counter products. And again, confirm that whatever lesion you have on your face is actually acne and not something else. And do not apply too much of products on your face. That is not going to help you in any way. Keep your makeup to a minimum as possible for your daily needs. That's all.
Thank you so very much, Dr. Reshma N.P. It was wonderful talking to you. It was a very, very informative and interesting session for our viewers as well. Thank you once again.
Thank you so much.
Thank you, Doctor. And viewers, thank you for your excellent participation. Stay happy, stay healthy, and take care of yourself. Have a great day.
Yeah, thank you. Have a good day. Yeah, thank you.
You too, Doctor. Good day to all of you. Goodbye.